Health literacy. There is no universal definition for literacy. At the most basic level, literacy is the ability to read and write. According to the National Center for Educational Statistics, an individual's ability to adequately read, write, and speak English and compute and solve problems at levels of proficiency necessary to function on the job and in society, to achieve one's goal and to develop one's knowledge and potential. Low literacy affects people from all ages, races, income, and educational levels in the US. It is twice as common among older adults, individuals with low income, individuals who speak English as another language, and individuals receiving Medicaid benefits. The National Adult Literacy Survey, or NALS. This survey provided a profile of English literacy among individuals 16 years and older in the US. It was first done in 1992 and was replaced with the National Assessment of Adult Literacy in 2003. NALS, the literacy level was assessed based on prose tasks, document tasks, and quantitative tasks. The assessment is conducted in English, so it's for English literacy. Prose literacy. Prose literacy is the knowledge and skills needed to understand and use written materials. These tasks include locating information in a newspaper, interpreting instructions from a warranty, following a recipe, reading food labels, inferring a theme from a poem, and reading an article and finding the main points. Document literacy is the knowledge and skills required to locate and use written materials. These tasks include completing a job application, finding the right bus or train from a schedule, finding an intersection on a map, finding information in a table or graph. Quantitative literacy, sometimes called numeracy, is the knowledge and skills needed to apply arithmetic operations using numbers embedded in written materials. These tasks include balancing a checkbook, calculating a tip, totaling a bank deposit slip, and determining the amount of interest on a loan. From the 1992 scoring, you can see that literacy levels 1 and 2 they are the lowest literacy levels. At literacy level 3, this is considered functional literacy, and levels 4 and 5 are the highest literacy levels. Based on this, 1 in 2 Americans function at literacy levels 1 and 2, and 1 in 3 American adults are functionally illiterate. The 1992 findings also showed that for level 1, the lowest literacy level, 16 to 20% were high school graduates. In level 2, 33 to 38% were high school graduates. And for levels 1 and 2, 15 to 19% were college graduates. Program for the International Assessment of Adult Competencies, or PIAC. This survey replaced the previous literacy surveys in 2012, and it was last administered in 2023. It is a large-scale international study of working-age adults, ages 16 to 74 in the US and 16 to 65 in other countries. The assessment is conducted in English, so again, it's for English literacy. It assesses adult skills in 3 domains: literacy, which we previously called prose literacy, numeracy, which we previously called quantitative literacy, and adaptive problem solving, which replaced the term digital problem solving in 2023. This new assessment defines literacy as the ability to understand, evaluate, use, and engage with written text to participate in society, to achieve one's goals, and to develop one's knowledge and potential. In this particular assessment, there are actually 6 different levels. You have a new level that's called below level 1. So below level 1 and level 1 are considered low literacy. Functional literacy is here at level 2 and 3, and then the high literacy levels are 4 and 5. So let us look at how literacy levels changed between 2017 to 2023. And unfortunately, these levels were actually increasing. Not a good thing. It means that we actually had more people who were not doing well with these literacy levels. So for whites, it went from 12% to 16% in literacy, 20% to 21% in numeracy, and 21% in adaptive problem solving. Note that adaptive problem solving was first done in 2023, so that is the baseline. For blacks, 36% to 50% in literacy, 56% to 62% in numeracy, and 58% for adaptive problem solving. For Hispanics, 31% to 45% in literacy, 45% to 55% in numeracy, and 48% in adaptive problem solving. For other, 19% to 32% in literacy, 25% to 32% in numeracy, and 34% at adaptive problem solving. So overall, 4 in 5 US adults, or 79%, are at level 2 or above, meaning they have English literacy skills sufficient to complete tasks that require comparing and contrasting information, paraphrasing, or making low-level inferences. Health literacy. Health literacy can be defined as the ability to obtain, process, and understand basic health information needed to make appropriate health decisions. 9 out of 10 American adults have some problems with health literacy, and 1 in 2 have low health literacy. Adults with low health literacy report poorer overall health, are less likely to do preventive screenings, go for care in later stages of disease, have poorer understanding of treatment, and have lower adherence to medical regimen. And they are more likely to be hospitalized. These individuals also have problems searching for and using health information, adopting healthy behaviors, acting on important public health alerts. So, what factors affect health literacy? These factors include health providers with poor communication skills, health information that is provided in a complex and cumbersome way, the use of medical jargon, the patient's willingness or ability to ask questions and clarify details, and shame, stigma, embarrassment, or concerns about being judged can prevent individuals from asking questions or seeking clarification. Studies show that health education materials are unnecessarily complex and written at or above the 10th grade reading level. And informed consent forms are written at a 12th grade reading level. We've also found that medication package inserts are written at a 10th grade reading level, and these instructions in the medication inserts are also written in fine print. Moreover, emergency room discharge instructions are written at a college level. We also have found that the average patient reads at a 4th to 8th grade level, and it is recommended that general health education materials be written at about a 6th grade level. Materials for low literate clients should be written at a 3rd grade level and should use many pictures. Other types of literacy. Other types of literacy are becoming more important in a technology driven workforce. We now have to focus on e health literacy, digital literacy, computer literacy, media literacy, and AI literacy. In conclusion, the primary responsibility for improving health literacy lies with us, the health professionals, and the healthcare and public health systems. We must work together to ensure that health information and services can be understood and used by all Americans. Thank you for watching.